Hello, I'm Kerry Hull, America's Healthcare Advocate, and I'm in studio today with Dr. Kelly Logan. We're having an ongoing discussion about the uses of medical marijuana. You've heard Doctor talk about how you get a card. You've talked about some of the applications for things like arthritis, migraines, ulcerative colitis, etc. But here's one that we don't talk a lot about, but can make a big difference, and that's people that are in palliative care or hospice. Now, this is personal to me to some degree because I just lost two very good friends in the last month. And doctor, they went through absolute hell.
Yeah.
Okay. As they passed, obviously the drug they were given the most of was morphine, and then there was another one that I can't remember what it was. But they were very powerful drugs, and they had a lot of side effects, and they were absolutely miserable. Let's talk about how you contrast that with the use of medical marijuana in a hospice or palliative care setting, doctor.
So again, I am an osteopath, and I like to kill two birds with one stone, sometimes five birds with one stone, right? So when we're talking about decreased appetite, increased pain, any number of things. When you go into hospice and palliative care, we kind of change the goal, right? We're not going to push a lot of Western medicine on people. We're going to make people more comfortable. We want them to have good end of life and good quality of life. And so this is one of the things that I really feel passionate about, because when I took care of my stepdad, marijuana was not legal. And I really, really struggled with wanting him to have this. And so he passed in August 2018, and we passed marijuana in November 2018. And
right.
So since that time, I just, so many things come down to that end of life where you just want peace and comfort, and you want to be with your family, you want to be in the home setting, or if you're in a facility, you want to be comfortable in that facility. And we're throwing all of these things at people that just knock them out. And then you look at the plant-based medicine and you can see these profiles on all of the things that can make them antispasmodic, easier to care for and clean, easier to bathe, easier to feed. They are hungry.
Those are all basic issues.
These are just great issues at end of life, where as I get older and as I practice medicine longer, I see this more as, why are we not doing this? I mean, it just makes sense.
I don't think the information is out there, and I think that's one of the things we're trying to do here today is you need to understand this. I just watched a good friend of mine who finally told his wife, and he was here at KU Medical Center, I'm done. Take me home. I'm finished. Okay. His struggle would have been a lot less of a struggle.
Absolutely.
If he had had this particular care and been able to do what we're talking about today. So that's why we're doing this. The purpose of this and the purpose of these videos is to educate you on the opportunities that are out there and how to apply them in everyday life. And you just heard Doctor talk about things that are very common. Okay, how to take care of someone, how to feed someone, how to clean someone, how to bathe someone. Those are all things that at end of life, somebody else is typically doing for that person. So if medical marijuana here helps in that situation and makes that more manageable, it's certainly something we should consider. Thank you, Doctor.
Absolutely.
And we hope you're learning as you're listening here on America's Healthcare Advocate. Thank you.